Epilepsy affects 3 million Americans of all ages and is the fourth most common neurological disorder in the United States. We are learning more today from Dr. Eric Marchand, Associate Professor of Neurosurgery at the UNM Hospital. Doctor, thank you for joining us.
Good morning.
Important information here. So first, let's clarify exactly what epilepsy is.
Epilepsy is a condition where people have repeated seizures, brain seizures, that being an abnormal electrical discharge of the brain, which leads to some alteration of consciousness or uncontrolled movements, or both.
Or both. Okay. And do we know what causes it?
A number of things do. It can be hereditary. A lot of it is acquired from trauma. Other insults to the brain with deprivation of oxygen or blood supply to the brain, like a stroke, can lead to epilepsy. Tumors can lead to epilepsy also.
Wow, okay, so there's a lot of different things that can affect it and cause it. Well, one question that I'm sure a lot of folks have, and maybe a big misconception, can epilepsy be cured?
Well, seizures can be controlled, and for most people, that's possible just with medications.
Okay.
It's not clear that that's a cure, since when you stop taking the medications, they tend to come back, but you can put it in remission. And so, in a way, the disease can be controlled and people can live normal lives.
Okay. Well, so you were saying with medications they can be controlled. What are the typical medications that people take to control it?
Oh, there's a large number of them now. There used to be just a small number, but there's been a lot of special drugs developed over the years. You know, our old drugs were phenobarbital, which was just a barbiturate. Dilanthin is a common one. Keppra is one that's used a lot now, but there are many others for different types of epilepsy.
Okay. And during the break we were talking a little about this. You were saying that about 80% of conditions can be treated with medication, but that 20% that may not respond to it do need surgical intervention. So can you talk a little bit about that surgical intervention?
Well, there's not always a surgical intervention, but they need to be considered for some more aggressive treatment, since the medicines aren't working. And that involves monitoring of the brain and can lead to, at most aggressive treatments, resection of parts of the brain where the epilepsy is originating. That can even include half of the brain in some rare circumstances. So interventions can be aggressive and quite successful in the appropriate candidates. But there's also a move afoot to have some more or some less invasive procedures done to achieve the same goal.
What are some of those procedures?
Most of this involves brain stimulation electrically. One that's been around for a while involves stimulating the brain through a nerve in the neck and sort of back driving the brain. It's called vagal nerve stimulation, and that's a beneficial thing. Recently approved is a more sophisticated device which implants electrodes on the brain, detects when a seizure is happening, applies a stimulus to block the seizure.
Okay.
That's called NeuroPace, and that's just recently been FDA approved after more than a decade of work, and it holds a lot of promise for many people.
Well, that's good to hear. Well, so I'm sure a lot of people that do take medication for this are wondering if they are, after these procedures, can they get off their meds?
Very few people do. Okay. It used to be a major goal to try to get people off medications, but many of them would then relapse, have more seizures, and so most people remain on medications, perhaps at a lower dose or fewer medications, but almost everybody stays on medications now.
So really it's all about control and maintenance of the condition.
Preventing the seizures, which are very disturbing to your life and to your activities.
Yeah, absolutely. Well, how can our viewers learn more about the Department of Neurosurgery?
We're at University of New Mexico School of Medicine, website at UNM School of Medicine, and I work in conjunction with my neurology colleagues in the Department of Neurology.
Okay, great. And one last question for you, Doctor. Do we need to be referred by our primary care physician?
Referrals usually go through neurology before surgery is considered, because it's just a small percentage of people that finally get to needing those special treatments.
Sure. Well, Doctor, thank you for your time this morning and your information. Pleasure to see you.